Hi, everybody. I know I'm a little late, but here we are. Back on a great start for 2022. So, this is Dr. Verdialis from the Georgia office, and I'm actually up here in Syracuse these days. Anyway, happy to be back online asking questions and answering questions. Um, I always like to talk about a few things that have showed up in the last few days. Um, I have to say, the most challenging case for the week is a patient. It's a very dear patient of mine that has been. She's a new patient. Um, she has been trying for a while, and her husband forgot to tell her that that he had a vasectomy. So I don't know. I've been thinking about her for a long time, and how hard it was probably for her to realize that it was not her thing. It was actually her husband having a vasectomy that was the issue. And it was not until she actually came to the office that she started the kind of the basic workup. And when she came back to the house, to their home, to tell him that he needed to do a semen analysis, he told her, "Hey, well, I know I have issues," and she was baffled. And he kept saying, "I have issues, I have issues," until he actually um, just confessed that he actually had a vasectomy from the first marriage. And there she was, a year later, trying to get pregnant, and he never told her that he had a vasectomy. I mean, I don't know. I have her very, 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 very close to my heart. I mean, there's some crazy stuff that happens every day, people. But I see that you're all very active out here, so let's see what's cooking. Hello to everybody. Happy New Year. It's a great year. If you've noticed, it's a 2022, which in numerology, it's a very big number. It's a number of creation. So, number of creation, fertility, creation. So, I'll leave it out there for you. Can one do a day 3 own egg fresh transfer and a day 5 frozen transfer on the same time? That actually happened today. Okay. I don't really advise it. Sorry, people. Dr. Kills today did a day 5 transfer on somebody that had a day 3 transfer 2 days ago. This is the challenge. Look, from the bottom of my heart, I want you to be pregnant. But even with ultrasound guided embryo transfer, it's a little blind. Okay, so if you have a day 3 transfer that's trying to implant, and then you go and disturb the whole thing and put another embryo, you're actually going in and disturb the day 3 transfer, because you know the catheter, the manipulation, everything that goes with it. It's going to disturb the potential day 3 transfer that might have been implanting. People, please let it happen. If it doesn't work, then do the next transfer. Okay? As much as we try, I mean, there's no freaking way for us to mm, avoid the potential day chi transfer place. It's it's not happening. So, I mean, I wish you could see it from my angle. Like you're gonna put in a catheter, you're gonna disturb the area, you're gonna cause irritation. I would be happily surprised to see that something like that works. That's all I'm gonna say. All right. Can one do a three on transfer and then they again more of the same things? Choose a day. Just choose a day to put the embryos in. Why? Because in order to do a transfer, we're putting we're putting a catheter in. We're going to mess up your lining. It's just part of the process. So then just choose a day to put the embryos in and leave them alone and see which one sticks, okay? All right. What chance do you feel of a 2cc embryo that has, look, God knows what type of embryo I was. I hope I was a good embryo, but God knows, right? I mean, that's what Dr. K says all the time. We categorize our embryos subjectively. AA, BB, AB, whatever, CC. If you look at a group of kindergarten children, can you tell who of all of those, let's say 100 kids, it's going to be the next US president? You can't. So please relax. Embryo grading is subjective. So just relax, okay? I mean, yes, I can understand as a woman to go through the AA and then AB and maybe BB, but you know how many great, fantastic babies come out of a CC? So just again, this is a marathon. It's not a sprint race. I am so happy that you guys are coming in tonight. So, by the way, Happy New Year. This is 2022, a lot of twos. That means creativity, creation. I am claiming and declaring just a lot of love for all of you, okay? All right, let's see. Nicole. Can I use birth control pills to coordinate my egg retrieval to be a certain week? Yes, you can. Birth control can be very useful. In general, we at CNY don't use a lot of birth control to batch people because it might suppress people with low ovarian reserve. But if you're trying to time things for a embryo retrieval, that's fantastic. Bleeding at 6 weeks pregnant. Oh, Erica, that is a very big question. A lot of times we do bleed early on in pregnancy. I had that happen with my third pregnancy, and I didn't know what was happening. Luckily, she's 17 years old right now. A lot of pregnancy, I would say the majority of pregnancies will survive through a little bit of bleeding. So hanging there. Do you normally recommend embryo testing and ICSI for a couple with under? I don't. You know what I have seen with genetic testing in the embryos is that it's almost like opening a Pandora box. Um, once it's normal, but a normal embryo does not guarantee a normal pregnancy. And then once it's like there's the mosaics and this and that, and then those can self-correct. So it's kind of, it's not black and white. So it gets very, very complicated. I am 47 years old. If I ever went through this IVF treatment cycle, I would probably not test my embryos. And I mean, in my in my age group, I'm asking for a miracle. So I would go all out, just like if it happens, it happens. All right, Tiffany Michelle. All right. So I had my consultation with CNY Fertility on Monday, which will be the first day of my menses. Well, all right. So, for those of you out there that are trying this new fertility ways, this is how it goes, okay? So, we do need day 3 labs. That would be FSH, LH, estradiol, and progesterone. Just freaking get it, okay? Why? Because it's like that together with the AMH, meaning the anti-Mullerian hormone, is going to let us know how are you going to respond to this whole craziness, right? It's going to let us know what is your ovarian reserve. And that's very important, not only for us, but for you, right? So just let's figure out how much you have left, all right? And then check a semen analysis, make sure we're not having any thyroid issues, any, pre-diabetes issues, any prolactin, so any pituitary issues. And that's why we ask for all this craziness. It's just to make sure you're okay. Mm-hmm. All right. I am at 4 weeks and 6 days. Bless you, Tiffany. I am so happy. You don't understand. It's like I love being a mom. I was just talking. Look, I'm up in Syracuse talking about my kids. I love being a mom. I want you guys to be a mom. It's like the best thing ever. So congratulations, Tiffany. I am 4 weeks, 6 weeks prego. I'm having pulling pain near ovaries. Okay, so early pregnancy signs. They're a little wackety whack, okay? You're going to feel cramping. There might be a little bit of spotting. Don't freak out. As long as it is spotting or brown discharge, is old blood, we're good. So just, girl, just go there, fly high. Hold on to it. Pray about it, okay? Now, when we do have heavy bleeding during those early few pregnancy weeks, we want to make sure that everything is okay. Again, spotting, brown discharge, we're probably okay. All right, April. First FET worked but ended in a miscarriage. I'm sorry, sweetheart. How likely is FET to want to work? Probably very likely. Can 45-year-old have a natural baby? Natural? Absolutely. Absolutely. I see spontaneous pregnancies on 47, 48. Okay. Those of you out there looking at this, we might have to work on a few things, but you can do it. I'm all for you. I am for you. Write down this number, 770 2660933. That is the Atlanta office. One of the, that's a backline Atlanta office. I love the underdog. I love helping you guys. Okay. I am 47 years old and loving it. And I would love to see a lot of spontaneous pregnancies in their 40s. I don't know, maybe I'm a little psycho. I just love it. I had labs this morning. Nurse called. I'm out. Lupron. Lupron is a GnRH agonist. Okay, people. And that has been used for many, many years. That was actually the only medication that our old EREIs had for suppressing and stimming and blah, blah, blah. So Stetratide and ganirelix are pretty new. And at one point, there was only Lupron. And honestly, I've seen great results on decreased ovarian reserve in terms of getting them to a true baseline or having a Lupron flare, meaning using Lupron as a little poof to get them going a little faster. So Lupron is a great drug. It suppresses or stimulates your ovaries at a brain level, okay? I'm so excited. You guys are really cool today. It's a great week. It's a great month. It's a great year. Again, 2022 is going to be just blasting with blessings. PGT. Gosh. So, pre-genetic testing. It's very controversial. It's very controversial among doctors. They go back and forth. From what I've seen, if I would do again, I am a very proud 47-year-old. I would not do shit. Why? Because the result, okay, so I got a lot of patients doing PGT testing for sex or PG testing for, making sure they're normal embryos. And then the results are kind of mixed. What do you do with a complex mosaic or this and that and abnormal? The results are crazy. They're really complicated. And at the end, then you get the mosaics that could correct themselves and become normal babies. So I would the statistics for the United States, and I think probably for the world, is like around 50, 49, 51, 52%, right? Success rate with IVF. And as part of this amazing company, CNY is right there with the national numbers at 50%. I would just leave the rest for God. I understand you could have a baby with some disability disorders, but believe it or not, that is actually the exception. Either it actually implants or it doesn't. So, Akisha, I'm all for you at 45 having a baby. That's all I'm going to say. How many follicles, Mihilda, is it normal to find in the ovaries on the third day of menstruation? Okay, a true baseline is when the ovaries are fairly quiet. Okay, so at the third day of menstruation, and they're somewhere between 5 and 6 centimeters. It's not that big of a deal how many, as long as they're small. Sometimes if on a younger lady, 7 to 8, right? So 4, 5, 4, 5, as long as they're small on the third day of menses. What if you can get a baseline scan until day 4? It's gonna really depend on you. How is your ovarian reserve, and how are you responding, in terms of your natural cycle. So glad you guys are coming in with all these questions. All right. I had my follicle blood test done. All right. So your estrogen was 97. May I help to add a date for menstruation? All right. All right, Wendelin. When you're dealing with an FET cycle, meaning you're trying to transfer an embryo, and maybe the numbers are not perfect, your aim is to suppress. Okay, sweetheart? So you don't need to go crazy with it. I see that your estrogen is 92. So just go with the flow and suppress it. Suppress ovulation before everything so you can transfer your embryos. Merry Christmas to all of you. I want you to understand I love you very much. I do this out of the goodness of my heart because I want you to get pregnant. I hated being pregnant, but I do love my kids. I love being a mom, and I think that every human being should be allowed to be a parent. Can you do anything naturally at 42 to lower your FSH? Hell shit, Mindy. Um, that's why we do priming. I would do keto diet. I know it's hard. I know it's hard. Look, I'm trying myself. I'm there with you. We're all in this together. So get off the grains, okay? Wheat, corn, soy, oats. Try to clean up your diet, processed foods, all that crap. Get it out of the way. I'd rather you have sweet potatoes and carrots and pasta. You get the picture. And then there's priming with human growth hormone. There's PRP. I love PRP. I use it. I use it with my girls in the office. Platelet rich plasma is the works. Okay. We use it for skin, hair, back pain, and we use it for fertility. It really reverses aging factors. Then there's the Glandular Therapy. For those of you that have spoken to me, I talk about the female endocrine pack. What the F is the female endocrine pack? It is corn seed oil, omega-3, whole food vitamin, and then glandular therapy. What does that mean? That means little bits of ovary, pituitary, adrenal, thyroid. So I'm all about supporting you so you do better. Those are things, Mindy, that's gonna really kick in. And human growth hormone. It's huge. And there's some new research on NAD plus. So we've been doing NAD plus at the Atlanta office of infusions. Again, anything that's anti-aging is going to work in favor of your ovaries. Make sense? By the way, I love you guys from the bottom of my heart. Thank you, Nicole, for your love. Transferring again, hit it, baby. Just go for it. Why? Because um, egg retrievals and previous transfers are warm-up processes for transfer. There was a studies from the 20s, 30s that showed that 6 months after a pregnancy, no matter how it ended, there is a hyper fertility state. Okay, so just hit it. Okay. I would like to know if I should transfer more than one blastocyst. You can. I would never ever encourage to transfer more than two at a time because I mean it's crazy how Murphy's laws work. You could transfer two and they'll implant and you end up with twins. And you don't want, trust me, you don't want to have more than two babies at the same time. So exciting. You guys are awesome. I love you. It's interesting that CNY does not recommend PGT testing. The more I see Maria, the less I recommend the PGT testing. It is it's an available service. We're not gonna block you. Go for it. But I see so many PGT tested normal embryos don't implant, and then the one embryo that was supposed to be a piece of crap becomes a normal baby. That I'm not digging it. Hey Heather, sweetheart, I love you. I don't know. All right, baby. I know, Heather, you've been through some interesting ways. Let's talk a little deeper about your journey, okay? I don't think this is the right space, but don't get discouraged, okay? I'm all for you. Oh my goodness gracious, you guys are hot today, huh? Holy shit! I can't get up to you. Ah. All right. So Johanna, 18 millimeter fibroid inside the uterus need to be removed. Now let's just ignore that shit. Castor oil packs for adhesions. Yeah, adhesions. Castor oil packs, absolutely. Eutrophin or uterine glandulars, absolutely. Serapeptides, the king. Hell yeah. Okay, so Miss Kelsey had a hysterectomy. Shit happens. It happens. And then she's gonna try to have a babe and 10 large follicles. Is that good? Absolutely. 10 large follicles should give you 5 embryos, 5 baby embryos. All right, that's a lot of questions, girls and boys. I had a wonderful boy yesterday. Okay, I know you have a lot of questions, people. I love you very much, and I want you to be happy. If you have a very distinct question, please, I beg you, write me. I am Dr. Verdialis. My last name is pretty weird, so you can't miss it. Write me. I will get back to you one way or another. We will get through this. My goal is for you to be pregnant. I love it. I mean, I just love making parents. It just makes me, there's not enough money in this world to make me happy about this. So, time's up. Write me on a personal level. I get back to you within 24 hours. Make sure we can talk and get a plan for you. We will get you going. I love you all. Merry Christmas and Happy New Year.